operating here, because racism is not a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms which are in our structures, policies, practices, norms, and values, which are different aspects of decision making. Structures are the who, what, when, and where of decision making, especially who's at the table, who's not, what's on the agenda, what's not. Policies are the written how of decision making, practices and norms are the unwritten how of decision making, and values are the why. And by taking that exercise, how is racism operating here, we can identify levers for action. And then we can each pull on a different lever, but all in concert, and we can do something. The definition I gave you of racism can be generalized to be a definition of any system of structured inequity. What's sexism? That's a system of structuring opportunity and is undervalued based on gender, that unfairly disadvantages, unfairly advantages, and saps the strength of the whole society. There are many axes of inequity operating in our society today, intersecting in individuals as well as in communities. They're all risk markers for how opportunity is structured and values assigned, even as a smaller group, are actually risk factors. So then you might say, Dr. Jones, you just spent an hour talking about race and racism, and now you're telling me you see all of this? Why do you spend your work on race as the axis of inequity and racism as a system? And my answer is that racism is foundational in our nation's history, and yet many people are in denial of its continued existence and profound impacts on the health and well-being of the nation. So I actually encourage all of us to be actively anti-racist, even as we also take up these other struggles. And to the extent that we're able to dismantle some of the mechanisms of racism, we will benefit these other struggles as well. Here's a three-part definition of health equity. What is it? How do we get there? How's it related to health disparities? Health equity is a process. Which process? Assurance. Assurance of what? Of the conditions for optimal health, the social determinants of health. For whom? For all people. That's what makes it equity. Getting there requires at least three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. And how is it related to health disparities? Health disparities will be eliminated when health equity is achieved. Disparities are differences in outcomes. Equity is all about the distribution of opportunities and resources before that. There are three huge barriers to achieving health equity. I gave them to you before. Our narrow focus on the individual makes systems and structures invisible or irrelevant, and also constrains our notion of our power. We think about what can I do, not what can we do. We lose our sense of collective efficacy. The second, ahistorical, we act as if the present were disconnected from the past, which also makes us think that if this structure were here when I was born, it must have always been here, it must have always been to be here. And it makes us not feel a sense of being able to change structures. And then finally, the myth of meritocracy. I'll just have to say here, when we deny racism, we are endorsing the myth of meritocracy, and there are two ways to deny racism. You can say, I don't think racism exists anymore here. Or you can never say the word. Because if you never say the word racism in the context of widespread denial, you're complicit with that denial. So here's the last thing. I could end with a story, but you guys you'll have to tell me. But here's the last, this is like a real ending, and then there's a 2-minute story I could tell you if you want it. But here, so I've been starting to think, what do we do? Like, how do you know if you're doing something that's about equity? Well, first of all, I use those three principles for achieving health equity. I glossed over them quickly, but valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources not equally, but according to need. But also use black holes. You know, like black holes in the universe, like you can't really see them, but you can detect them because all the energy is being sucked in, or whatever, like that. Well, there are three ways that I think we can use that kind of absence of thinking. The first is to look for evidence, actively look for evidence of two-sided something. Don't just sit in the restaurant asking, why don't those people just come on in and sit down and eat? Get up, open the door, go outside, see what it looks like on the other side of our bubbles. Right. Actively look for evidence of two-sided science. Shine the bright light of inquiry. Is there something differential going on even in my own practice? Look for differences in outcomes as well as differences in opportunities, exposures, resources, risks. The second is to see the absence of. Whenever you are sitting at a decision-making table, get in the habit of looking around and saying, who is not here, who has an interest in this proceeding? And then your job is not just to represent their interest, but to find them a way to the table. So who's not at the table? What's not on the agenda? What policies do not yet exist? Don't just do a health impact assessment or equity impact assessment or written policies. What's not there that if put in place could be quite useful? What are we not doing? And that gets me to the third thing. We need to get in the habit of revealing inaction in the face of need. That is how institutionalized racism is working most times these days. Inaction in the face of need. What's wrong with the three-dimensional clip? Right? So here's the question, do you want a 3-minute story